I need you to stop what you are doing right now and listen to me carefully. I am going to tell you about a 67-year-old man who came into my emergency department on a Thursday morning. He was retired. He had spent his career as an engineer, meticulous, disciplined, a man who took care of himself. He walked every morning. He watched what he ate. His blood pressure was controlled. By every measure, he was a healthy man in his 60s doing everything right. That Thursday morning, he woke up with the usual stiffness in his neck that had been bothering him for years. He sat on the edge of his bed, placed both hands on the sides of his head, and twisted hard to the right. He had done this every morning for over 20 years. He heard the pop. He felt the brief release he was looking for. And then, within 40 seconds, he felt something he had never felt before. A crushing headache at the base of his skull, moving upward. He described it later as feeling like something had been pulled tight inside his head. He tried to stand, and the room tilted. He reached for the bedside table and missed it entirely. His wife found him on the floor, conscious but unable to coordinate his movements, the right side of his face drooping. He was 67 years old. He was otherwise healthy. He had a routine, a wife, grandchildren he was supposed to see that weekend. And what destroyed his morning, and very nearly his life, was something he had been doing for relief since his 40s. Something he thought was harmless. Something tens of millions of people around the world do every single day. Some of them while watching videos exactly like this one. I am a physician. I have been practicing for over 30 years. I specialized in neurology and internal medicine. I have seen patients survive cancer. I have seen patients come back from things that should have killed them. And I have also watched perfectly healthy people arrive in my department, unable to move half their body because of something that takes 3 seconds and feels completely normal to do. This video is not for entertainment. I am not here to frighten you for clicks. I am here because I have watched this happen too many times, and I have realized that most people have never been told the truth about what they are doing to their own nervous system. Watch this fully. What I am about to explain is not covered in general health advice. Your doctor may never bring this up unless something goes wrong. And by the time something goes wrong, it may already be too late to reverse. Let me start with the anatomy, because you need to understand what is actually happening inside your neck before I can explain why this is so dangerous. Your neck is not just bone and muscle. Running through the bones of your cervical spine, the 7 vertebrae that stack on top of each other between your skull and your upper back, are 2 arteries. They are called the vertebral arteries, one on the left, one on the right. They travel upward through small holes in the bones of your neck, and then they enter the base of your skull and merge into a single vessel called the basilar artery. That basilar artery feeds blood directly to your brainstem and your cerebellum. Your brainstem controls your breathing, your heart rate, your blood pressure, your ability to swallow, your consciousness. Your cerebellum controls your balance, your coordination, your fine motor control. These 2 vertebral arteries are not large vessels. They are thin, they are delicate, and they are wrapped around, pressed against, and physically constrained by the bones of your spine as they travel upward. Now, when you twist your neck sharply, when you crack it, when you wrench it to one side with force, what you are doing is putting a sudden rotational stress on those bones, and those bones are moving around those arteries. The wall of an artery is not made of rubber. It is made of several layers of tissue. There is an outer layer, a middle muscular layer, and a delicate inner lining called the intima. When you apply sudden high-velocity rotational force to the neck, you can tear the inner lining of the vertebral artery. This is called a vertebral artery dissection. The word dissection here does not mean a surgeon cutting something open. It means the layers of the artery wall are separating from each other. A flap of inner lining tears away from the wall. Blood gets in between those layers. The artery begins to swell from the inside. The channel through which blood flows becomes narrow. A clot forms at the site of the tear, and then that clot breaks off and travels upstream, directly into your brainstem. That is a stroke, not a minor event. A posterior circulation stroke, which affects the brainstem and cerebellum, is one of the most devastating types of stroke a person can have. Many patients with this type of stroke do not survive. Of those who do survive, many are left with permanent paralysis, loss of balance, inability to swallow, vision loss, or locked-in syndrome, a condition where the person is fully conscious but cannot move or communicate. The 67-year-old man I told you about, he survived. But 9 months later, when I last had information about his case, he still could not walk without a cane. His coordination on the right side remained impaired. He had not driven a car since that Thursday morning. He had missed his grandchildren's school recital because he was still in rehabilitation. He had been a man who walked every day, and now he needed help getting dressed. And the thing that caused this? Cracking his neck. Now I know what some of you are thinking. You have been doing this for years, and nothing has happened. You are fine. Your friend does it. Everyone does it. Yes. And that is the most dangerous part of this entire situation. Vertebral artery dissection from cervical manipulation or self-manipulation does not happen every time. It does not even happen most times. This is not like touching a hot stove where the consequence is immediate and obvious. This is a progressive structural problem. Every time you apply sudden rotational force to your cervical spine, you are creating microstress on those arterial walls. You may do this for 10 years without incident. You may do this for 20 years, but every time you are accumulating damage to tissue that does not repair itself perfectly. The wall becomes slightly weaker, the tissue loses its elasticity, and then one morning, at a threshold, you cannot predict and cannot feel coming. It tears. The medical literature is clear on this. Vertebral artery dissection is one of the leading causes of stroke in people under the age of 45. In young, healthy adults with no cardiac risk factors, no high blood pressure, no diabetes, it is one of the top causes. And in study after study, researchers have found that sudden cervical manipulation, including self-manipulation, is documented in the patient histories of a significant proportion of these cases. I want to be precise here because I have seen people argue that the evidence is not strong enough, that the relationship is not proven, that the studies are small. Let me address this directly. The reason we do not have massive randomized controlled trial data on this is because you cannot ethically take a large population of people, have half of them crack their necks daily for 20 years, and measure the outcomes. What we have instead is case series, biomechanical studies, cadaver studies measuring arterial stress under rotation, and clinical observations from neurologists and emergency physicians who see these patients. In the cadaver studies, researchers have measured the strain placed on vertebral arteries during high-velocity cervical manipulation. The findings show that at certain angles of rotation, particularly rotation combined with extension, which is exactly what many people do when they crack their neck by tilting the head back and to the side, the vertebral artery is stretched and compressed simultaneously. The internal wall experiences shear forces that exceed what healthy arterial tissue is designed to tolerate repeatedly over a lifetime. The clinical picture I see in my practice and in published literature is consistent. Patients present with sudden neck pain, headache at the base of the skull, dizziness, one-sided facial numbness, loss of coordination, or in the worst cases, sudden loss of consciousness. Often the event that triggered it was something that seemed trivial. Turning to look over their shoulder while driving, a sudden sneeze, an awkward movement during exercise, and, for a significant subset, a deliberate, forceful twist of the neck seeking the pop. The pop, by the way, is not the sound of a bone moving back into place. There is no bone out of place to move. The sound you hear, the crack, is a phenomenon called cavitation. Inside the synovial fluid that lubricates your joints, dissolved gases form tiny bubbles under pressure changes. When you stretch the joint capsule quickly, the pressure drops, the bubbles collapse, and you hear a pop. That is all it is. There is no therapeutic release. There is no decompression of a nerve. There is no benefit. The relief you feel afterward is a combination of the muscle stretch reflex, relaxing the surrounding muscles, and a brief flood of endorphins from the sudden mechanical stimulation. It lasts minutes, and the cost is cumulative arterial wall stress. I want to talk now about who is most at risk, because this is not equally distributed. The first group is people who do this forcefully and frequently. If you crack your neck every morning, multiple times a day, both sides, using both hands to maximize the rotation, you are in the highest risk category I can identify from clinical patterns. The frequency matters, the force matters, the angle matters. The second group, and this is the group I want you to pay close attention to if you are over 60, is people whose arterial walls have already changed with age. This is not a condition you develop. This is simply what happens to arteries over decades. The arterial wall loses elasticity. Collagen fibers that once gave the vessel flexibility become stiffer and more brittle. In many people over 60, there is also a degree of atherosclerosis, plaque buildup inside arterial walls, that further compromises their structural integrity. The vertebral arteries are no exception. The same rotational force that a 35-year-old arterial wall might absorb without tearing is a very different mechanical challenge to a 65-year-old arterial wall. You are not the same person you were 20 years ago. Your arteries are not either. The third group is people who have already had a minor arterial injury and do not know it. Vertebral artery dissection can be partial. A small tear can form, create a very small clot, and cause symptoms so mild that the person dismisses them. Mild dizziness for a few hours, a brief headache at the back of the head, fleeting numbness in the face or arm. I have had patients tell me during intake that they had a weird dizzy spell 3 weeks earlier that lasted an afternoon and then resolved. In many of those cases, imaging showed an existing dissection with partial healing. These patients were walking around with a compromised artery wall, and some of them had gone back to cracking their necks again after that initial episode. If you have ever had a sudden severe headache at the base of your skull, sometimes described as the worst headache of your life, that resolved on its own, I am asking you to take that seriously. That is a classic presentation of a sentinel headache from arterial disruption. It means something happened. Do not ignore it. The fourth group is people with connective tissue disorders, even mild or undiagnosed ones. Conditions like hypermobile Ehlers-Danlos syndrome affect the structural integrity of all connective tissue in the body, including arterial walls. Many people with this condition do not have a formal diagnosis. They simply know they are flexible, that their joints pop easily, that they are prone to sprains. These individuals have arterial walls that are already more susceptible to tearing under mechanical stress. Neck cracking in this population is particularly dangerous. Now I want to talk about the broader pattern of behavior that puts people in danger, because neck cracking is often not isolated. It is part of a cluster of self-manipulation habits that people develop because they are managing chronic tension, chronic pain, or chronic discomfort in the neck and upper back. And I have compassion for this. Chronic neck tension is real. The desire for relief is real. But the coping mechanisms people develop are often creating the very conditions that generate the tension in the first place. When you crack your neck repeatedly, the joint capsule stretches over time. The surrounding ligaments become lax. The muscles that are supposed to provide stability to the cervical spine compensate by becoming chronically tight, because the passive stabilizers, the ligaments, are no longer doing their job properly. So the tension returns faster. So you crack again sooner. You need to crack more frequently and more forcefully to get the same relief. This is a cycle of progressive destabilization that I have seen unfold in patients over years. The neck is not a self-service joint. It is the most vulnerable part of your spine from a vascular standpoint, and it houses or gives passage to some of the most critical neural and vascular structures in your body. The way you would not repeatedly and forcefully bend a pipe that has wires running through it, you should not be applying habitual high-velocity rotation to a structure with 2 blood vessels threading through it. I want to spend a few minutes now on what a vertebral artery dissection stroke actually feels like in real time, because some of you watching this may live alone, or your spouse may be at risk, and recognizing this early can make the difference between death and survival. The onset is often deceptive. Unlike a classic ischemic stroke from blocked carotid arteries, which often presents suddenly and dramatically, face drooping, arm weakness, speech slurring, a posterior circulation stroke from vertebral artery dissection can begin gradually or with symptoms that seem to come and go. The warning signs I want you to memorize: sudden onset headache at the back of the head, particularly if it is severe and unlike any headache you have experienced before; dizziness or vertigo that comes on suddenly; double vision or sudden loss of part of the visual field; difficulty swallowing or sudden hoarseness; sudden loss of coordination, stumbling, dropping things; inability to walk in a straight line; numbness or tingling on one side of the face or body; sudden extreme nausea with none of the usual causes; any one of these symptoms following neck manipulation, vigorous exercise involving the neck, or even a simple sudden movement of the head. This is a neurological emergency. Call emergency services immediately. Time to treatment is critical. Every minute that brain tissue is not receiving adequate blood flow, neurons are dying. The window for intervention with clot-dissolving medication is narrow. Do not wait to see if it resolves. Do not sleep it off. Get to a hospital. Now. I want to address something I hear often, because I believe in being honest with people rather than just giving directives. Some of you will say, "Doctor, I went to a chiropractor for years and nothing happened." Others will say, "My physical therapist does cervical manipulation on me and it helps." Here is my honest answer. The risk from professionally performed cervical manipulation, when done by a trained practitioner who has screened for contraindications, is lower than the risk from untrained, self-directed, forceful neck cracking. This is not because the mechanism of injury is different. It is because professionals are trained to avoid the high-risk angles, to use lower force techniques, and to screen patients for vascular risk factors before proceeding. A good manual therapist will not perform high-velocity manipulation on a patient who has risk factors for vascular injury. But professional training does not eliminate the risk to zero. It reduces it. And self-manipulation, the kind most of you are doing at home, at your desk, in the morning before you get out of bed, has none of those safety controls. You do not screen yourself for contraindications. You do not know whether your vertebral arteries have pre-existing damage. You apply maximum force because that is what produces the most satisfying pop. You do it in positions you find instinctively comfortable, which are often the highest risk positions biomechanically. So, no, I am not telling you that professional cervical treatment is categorically dangerous. I am telling you that what you are doing to yourself at home, without training, without screening, without calibrated force, is a different category of risk entirely. Let me also address the argument that these events are rare. I have heard this used to dismiss the concern. Yes, it can happen, but it's so rare, why worry about it? Rare in what population? Rare compared to what? Vertebral artery dissection is the cause of approximately 2% of all ischemic strokes. In absolute numbers globally, that represents hundreds of thousands of cases per year. In patients under 45, the proportion is much higher. Some estimates put vertebral artery dissection as accounting for up to 15% of strokes in this age group. These are not vanishingly small numbers when you understand that stroke is one of the leading causes of death and permanent disability worldwide, and the people who experience this do not think it was rare. The 67-year-old man I told you about at the beginning of this video, his case is in someone's statistics as a data point. But to him, to his wife, to his grandchildren who visited him in rehabilitation instead of watching him walk through the door, the probability was 100%. I am not asking you to live in fear. I am asking you to stop doing something that has no real benefit and a genuine, documented, catastrophic downside. Now let me talk about what you should actually do if you have chronic neck tension, because I know that if I take away the only coping mechanism people have, I need to offer something real in its place. The most common driver of chronic neck tension that I see is not structural. It is postural and muscular. People who spend hours in a chair, reading, watching television, looking at a tablet or phone with their head pushed slightly forward of their center of gravity, develop what is called forward head posture. For every inch your head moves forward of its ideal position, the effective load on your cervical spine approximately doubles due to leverage. At 2 inches of forward displacement, which is completely normal for most people who read or use screens regularly, your neck muscles are supporting what feels like double the weight of your head. That is a sustained isometric load on muscles that were not designed for it. Of course, they become chronically tight. The solution to this is not to crack the tension away. That provides seconds of relief, and then the muscles contract again. The solution is addressing the underlying postural load, strengthening the deep cervical flexors. The muscles at the front of the neck that hold the head in proper alignment is the single most evidence-supported intervention I can recommend. These muscles are almost universally weak in people with chronic neck tension and forward head posture. When they are weak, the posterior neck muscles take over as stabilizers. They are not designed for that role, and they become chronically overloaded. Chin tucks, gentle retraction of the head to bring it back over the spine, activate these deep flexors and are simple enough to do while sitting in a chair. They are not exciting. They do not produce a satisfying pop, but they address the actual mechanism of the problem rather than masking the symptom. Thoracic mobility work is also critical because the upper thoracic spine directly influences the posture and load on the cervical spine. When the upper back is stiff and rounded, the neck compensates. Improving thoracic extension reduces the compensatory strain on the neck significantly. Heat, not cracking, is appropriate for acute muscle tension. A hot pack applied to the posterior neck for 15 to 20 minutes relaxes the musculature effectively, does not create joint hypermobility, and carries no vascular risk. For people over 60 especially, heat is the correct first-line intervention for the morning neck stiffness that so many of you are currently managing by twisting. Professional manual therapy, when indicated, performed by a trained practitioner who has screened you, there are safe, effective techniques that address cervical joint mobility without the high-velocity rotation that creates vascular risk. Soft tissue work, low-velocity mobilization, myofascial release. Ask specifically for non-thrust techniques if you have any concerns. And for those of you who have been cracking your neck for years and are now concerned about what may have already accumulated, I want to be direct with you. The absence of symptoms right now does not mean you have no damage. Partial arterial wall injuries can be silent. If you are in the habit of forceful, frequent cervical self-manipulation, and particularly if you are over 60, consider speaking with your physician about whether vascular imaging of the neck is appropriate for you. An MRI angiogram can visualize the vertebral arteries and identify any existing dissection, stenosis, or wall irregularity. It is not a routine screening test, and your doctor will make the decision based on your risk profile. But if you have had any of the warning symptoms I described, occipital headache, sudden dizziness, transient numbness, coordination issues, you should report them and ask about imaging directly. I want to close by coming back to the man who came to my department on that Thursday morning. When I spoke with him 2 days after his stroke, he was lying in the hospital bed, monitors attached, the coordination on his right side still largely absent. He was not emotional in the way you might expect. He was very quiet, still in the way people are when something has happened that has no precedent in their own life. He told me he had known for years that cracking his neck probably was not a good idea. He said he had thought about stopping. He said he kept telling himself he would address it properly when the tension wasn't so bad, when he found the right exercises, when he had the time. He was 67 years old, and he needed help walking, and he was going to go home and explain to his grandchildren why their grandfather, the man who used to take them hiking, now needed a cane to get to the kitchen. There is no good version of this story to tell you. There is no moment where I said something to him that made it easier. I am telling you this story so that I do not have to tell a version of it about you. I have told you the mechanism. I have told you the risk groups. I have told you why people over 60 face a specifically elevated danger. I have told you the warning signs. I have told you what to do instead. I have told you what to do if you are already concerned about damage you may have already accumulated. What I am asking you to do right now is simple. Stop. Not gradually. Not after the next time. Not after you deal with the tension you feel in your neck right now. Stop today. The tension is real. The discomfort is real. The habit is deeply wired. None of that requires you to continue. The only thing maintaining the habit at this point is the habit itself, because your brain has connected the act of cracking to the brief relief that follows, and it is now reflexive. You feel tension, your hands move. Break that loop, not because I told you to, because I have described to you, precisely and in detail, what that loop is costing you at the structural level, and you now understand that the cost does not always announce itself until it takes something from you that you cannot get back. I am a doctor. My job is to tell you the truth before something happens, not after. This is me telling you the truth. Stop cracking your neck.